Now let me know when you're ready, Karen.
Okay, we're good to go.
Okay, go ahead and fire it up.
We're live.
We're live. Thank you. Good morning. It is 9 a.m. on Tuesday morning, a regular board meeting for June 30th. And we have all three commissioners, one in the office, two remote, Keith Johnson and Karen Millam in the office also. So with that, we are called to order. And if you'd join me with the Pledge of Allegiance, please.
I pledge allegiance to the flag
The
of the
flag
United States of
United States of America and to the republic
For which it stands, one nation,
under
under
God,
God,
indivisible,
indivisible.
with liberty and justice for all.
Thank you. Our first item on the agenda this morning is approval minutes for June 2nd and June 10th. June 10th is the special meeting minutes. If there's no addition, changes, or corrections, I would entertain a motion.
Good as presented, Mr. Chairman. Move to approve.
I second.
All in favor?
Aye.
Aye.
Aye. And everybody that's on the YouTube, I'm just, notice the public comments come in through the phone, and just go ahead and phone in. You'll be in queue, and we'll answer them the best we can as they come in. So with that,
We have no callers on the line at the moment, Commissioner.
all right, thank you. Just break in whenever somebody does, and then we'll take them best we can.
Mr. Chairman, we have two items this morning in the agenda for financials. One is salary clearing payroll. The other is fund expenditures. If you're ready, I'll move for approval of salary clearing payroll, emergency management payroll, total amount of $1,013,814.56. Note that this has been signed off by two members of the auditor's office.
I second.
All in favor?
Aye.
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 And Mr. Chairman, second and final are warrants or fund expenditures. Move for approval as presented. Total amount $135,841.23. Note that this has been reviewed and signed off by the county administrator and two members of the auditor's office.
I second.
All in favor?
Aye.
Aye. With that, that'll lead us to the consent agenda of two items this morning.
Okay, Mr. Chairman, I see two items, as you said. Move for approval as presented, consent agenda.
I second.
Hearing no comments, ask for all in favor?
Aye.
Aye.
Aye. So that brings us right down to Keith at administration office.
Okay, thank you, Mr. Commissioner. I do want to just provide some updated information. As you're aware, the federal government instituted legislation known as the CARES Act earlier in the spring. With that CARES Act, there was money distributed to the states through our Department of Commerce that will be allocated to local governments throughout the state. Tentatively, Franklin County has been awarded a little over $5 million to be used for additional COVID-19 related expenses that were not included in the 2020 budget. It requires a contract to be signed with the Department of Commerce that we both understand and will assure that we utilize those funds in accordance with the requirements of the federal government as well as the requirements of the Department of Commerce. We submitted our initial working papers to the Department of Commerce several weeks ago. And the next step in that process was for the Department of Commerce to send us a contract for our final approval. We, as of today, or as of last week, had not yet received that contract back from them. We've received a draft of the contract, which I have reviewed and which our legal counsel has reviewed, and we have tentatively agreed to the terms of that contract. However, because we don't have a formal contract yet, I don't have anything to bring before the board for the board's final approval. So we are awaiting that any day. And once that contract is approved by the board, we can then begin to submit to the Department of Commerce billings for reimbursement for our additional costs as a result of the COVID-19 response. We've been working with the the Benton Franklin Health District, who is the intended recipient of most of that funds, because they are the ones that have had to incur the additional costs of testing and contact tracing and capturing the data of infection rates and working with the hospitals to provide PPE and other equipment necessary to address this in the community. We're expecting a significant amount of the $5 million to go to offset those additional costs that the health district has incurred. Secondly, we are looking at opportunities to fund COVID response reactions in the small business community. There are those that have had to buy additional social distancing mechanisms, improvements within their office, PP&E for their employees, and a number of different items that would qualify under the CARES Act funding, and have had some discussions with local economic development groups such as the Chambers of Commerce and TRIDEC and so forth, to be able to be in a situation to be prepared to distribute those funds once they become formally available. So I think we have a pretty good plan going forward. We have been coordinating with Benton County very closely, as well as the cities in the Tri-Cities area and beyond, all of our cities in Franklin County, to make sure that we've included the right personnel in making those decisions. But bottom line is there will still be decisions yet to be made by this board in the allocation of those proceeds once that contract gets finalized. I spoke with the Department of Commerce on Thursday of last week and let them know that we are anxiously awaiting that. They said they would push it to the front of the line and get that contract to us. I had hoped to have it before today's meeting, but I don't have that yet. So secondly, we are continuing to work with the Benton Franklin Health District and our partners in the cities around the Tri-Cities area to promote efforts to continue to flatten the curve by encouraging social distancing, the wearing of masks in public, which is now an order of the governor, as well as been an order from the Benton Franklin Health District's health officer to wear masks while in public and in public locations to try to reduce the rates of infections that we've seen in our county in the last couple of weeks that have spiked up. We've also seen that spike across the country in different locations that perhaps opened up some of their social and public areas a little early, and in those cases have also seen a spike in the number of cases. Our biggest concern continues to be not even so much the number of cases, but the fact that we are beginning to stress our hospital capacity with COVID patients. So long as the number of COVID cases increased, that's one thing if people are at home and self-isolating and not transmitting it. But when they become ill enough that they have to go to the hospital, then it puts a real strain on our resources as a public health system. And that remains our largest concern, is whether our hospitals have the capacity to take on additional patients at this time. And we are getting somewhat close to our limit, even though we haven't exceeded it yet. There are plans in place that if we do exceed it, we could potentially transport patients to Walla Walla or perhaps Spokane or another facility that has the bed space. But even those areas are starting to see some increases and are nervous about their capacity to take on additional COVID patients. As you are aware, Governor Inslee has made it a point to visit the Tri-Cities today. I do not have a agenda or prior talking points of what he will say. I think we're all anxiously awaiting some guidance from him. He will be attended by with the Secretary of Health, John Wiesman, and they will have a series of conversations with the different groups, including elected officials, law enforcement. He will be doing a public press conference and having a meeting with certain business leaders in the community. To my knowledge, that is a by invitation only conversation. And so because I was not one of those recipients of the invitation, I'm not quite sure who all did receive invitations to attend those different events. But I do expect that it will be similar to what happened in Yakima last week, where he will result in a discussion of what the Secretary of Health and what the governor would recommend in terms of opening Franklin County into a phase 1.5 or a phase 2 status to allow us to open more businesses and get more economic activity going as quickly as we can. I certainly don't intend to speak for the governor, but I think it's clear that there is a significant expectation that what we hear today will be an improved situation for Franklin County, and certainly demand that the local officials be allowed to manage more of the process so that we can get the economy moving again. So with that, I believe that's really all I have to cover this morning at this time, and certainly answer any questions that you may have the best I can, and we'll go from there.
Well, Keith, I got a few questions here I'd like to ask. This is supposedly a meeting with the local officials and the governor. And I would have to say that I did not receive an invitation. And I can understand why, because I am been pretty resistant of this governor's actions. But I still think that he needs to be all inclusive. After all, he was invited to the White House by the president, and he got to speak to the president and got to make a statement against the president. I think he should welcome all views, especially when our businesses are under attack here and been shut down, and their people are losing everything they've ever worked for. And I think that for him to handpick who he wants in the room is a sign of his power that he is portraying. Secondly, as you drive in from the blocks, there's two signs, one on 68 and there's one out here on Glade Road, that are signs that are put up, and they are rented. I stopped and looked at them. Who's authorized that, and who's paying for that?
The Department of Public Works has rented those. That came out of a discussion with all of the city managers and city administrators and mayors in the Tri-Cities region, of an effort to try to increase the visibility of reminding people of the governor's orders and the health department orders. So our public works department will initially pay for those, but we expect that they will be reimbursed through the CARES Act funding.
Okay, because I do have one problem with that, and that is the health departments in their booklet that they put out that we read through, and moving into phase 2, their report, they stated, and this is the health department's statement, that 80%, 86% of the new cases are Hispanic.
Yeah.
And with that, why is it not also putting this message in Spanish? We are a bilingual area. We have lots of workers, and it's only in English. That's the problem I have with it. We're not conveying this message to the whole body of the area. This is, we've got to put out.
I think that's a great observation, and we've had some discussion. I know the city of Pasco, I believe, is working on a special message, particularly for the Hispanic community. But I'll certainly be glad to look into.
Okay, the next thing I
Spanish
have
translation on those.
is our Ben Franklin Health District. It's been brought to my attention on their social media page, Facebook, a post that is celebrating and recognizing the LGBTQ, RSTUV, whatever, community. And why is our health board putting out political ads? Our health board is for the safety of the community for medical and health reasons, not for propaganda on promoting groups. If this is the case, I'm requesting that they put out a right to life ad for the unborn babies. Because if we're going to start using this as a political arena, our health department, then I think all parties should have inclusion in that also. That's very troubling to me, and I gave you that. You got it there in front of you. And I want the public to know that I am going to be bringing this up at the next health board meeting and asking who okayed this. Because this is not a political arena, our health board, our health district, I should say, Benton Franklin Health District. And the last thing I would like to ask is, last week, it was brought to our attention that an email was sent to a constituent. Now that constituent, I guess, requested a public records request. And I'm asking you, Keith, how did you get her email to respond to that?
Yeah, I'd be glad to respond to that, Commissioner. There was a series of 3 separate public records requests that she submitted to the public records officer, which is myself. And we are gathering the documents related to those public records requests. I will also point out that I have 2 or 3 personal emails from her going back 2 or 3 years to my personal email account. And I simply typed in her name into my searches, it came up, and that's the number I used it. Her email address is available on the State Republican Party website. Very easy to find, but I didn't use any county resources to locate her personal email address.
Okay, thank you for answering that. That's all, thank you.
Commissioner Cook, I do.
Mr. Chairman, Commissioner Peck?
Yes, please.
Go ahead, Commissioner Peck.
Yeah, on the second item that Commissioner Didier raised about the Facebook post, I spoke with the executive director of the health district. I concur that we ought not be making posts that are or have the potential to be perceived as political statements. The information I received was that was part of an information services established practice. Notice I didn't say policy. Practice of posting items like that in recognition of various months throughout the year that have been designated as recognition months for various issues. I explained to him that I didn't think that it was an appropriate use of the Facebook page, and I believe from his remarks that he concurred and said that he would speak with the information services people and have them cease doing those kinds of activities. So hopefully that's been addressed, but again, I concur with Commissioner Didier's thoughts on it. The signs on 68, it'll be interesting to find out, programming-wise, if in fact their software does bilingual. If it doesn't, we need to fix that, because that too is an appropriate point that if we're going to communicate with our audience, we need to be sensitive to their language needs. Keith, I can get with you offline on the third item, but I do have some questions about the CARES Act funding, whether or not the $5 million is for both counties or just Franklin County, and how in fact it's to be directed, or portions of it, to the health district, since we are separate entities. They're not a county function, and normally state funds would flow directly to them, not through the county. I realize that counties are typically the contracting agency for the state, but that's when we're dealing with local communities, for example, Basin City on a water project. In this case, the health district has an established contractual relationship with the state, and those funds go directly. So I'm just kind of putting those out. I'm not looking for answers right now, but I wanted to have those thoughts out there for the benefit of the whole board and anyone listening, and we can talk offline more. Thank you.
You bet.
May I ask, did anybody on this Board of Commissions, I know Keith and I didn't get an invitation today. Did anybody get an invitation to this event?
I did as chairman.
Oh, you did, Bob? Okay. Are you going to be attending then?
Yes, I am.
Thank you, sir.
Any further comments? Keith, we have anybody on the phone?
No, sir.
Okay, you have nothing else in your,
I don't believe so today.
okay? And I don't believe we need an executive session that I'm aware of.
Nope.
So anything else for the good of the board, gentlemen? Or Karen?
No.
If not, we are adjourned. Thank you.
Thanks, everyone.